Hi, welcome to Habitus's webinar about systems change. In this session, we will be focusing in on the inputs that are required for systems change to happen. You can watch this video or you can listen to it like a podcast too. We'll walk through Habitus's perspective of systems change, then we will zoom in on an activity about inputs. This is the first in a series of webinars and activities that you can join us online. All you have to do is email us or send us a message on social media if you'd like to come to and be made aware of events in the future. So my name's Callum. I'm a partner with Habitus Collective. My passion at Habitus is knowledge mobilization. So boiling down all of those complicated perspectives, concepts, research approaches, and the findings that we have at the end to share in ways that communities and lots of different people can understand. And I would say that that's why I like systems change work, because often it generates stories that we can understand in a way that seems to be more real than the quantitative data that's produced by programmatic evaluations. But all evaluations I love equally. I'll pass over to Laura, who will be joining me throughout this session today.
Thanks, Callum. I'm Laura. I'm the head of research and evaluation at Habitus, and I deal with kind of all things research from the design to delivery. My kind of passion project is developing creative and kind of grounded tools to capture impact and get people involved in research and evaluation. I think that this is why I really like systems change, because it kind of gives you space to be innovative and creative in terms of how we define and understand impact of a project or an intervention. And this is something that we are going to be talking about today.
Great. Okay, over to the slides. So who the heck is Habitus Collective? Some of you may already know who we are. We might be new to a few of you. So just to let you know, we truly are a collective and we steer into being a collective. We're based both in Canada and in the UK. Simply put, we're a social research organization and support as well with organizational capacity, co-development, and our absolute loves are systems change, peer support, impact evaluation, and that normally kind of lands within community and mental health. We work with the NHS, we work with charities, we work with lots of different organizations, local government here in the UK. We're small, we're mighty, but we're mighty, I think. And then we also have a larger office in Western Canada, but we work right across Canada too. And together we love to share ideas across the Atlantic. Things that work really well in Canada, we love bringing over here, and things in the UK where I'm based. And we love to bring ideas in the UK over to Canada too, because there's some really smart people on both sides of that ocean. Um, like I said, we're a collective for a reason. So sure, we have staff in both Canada and in the UK. We've got a team of staff, but we also partner with lots of different consultants, academics, researchers, because there's an awful lot of smart people out there, and we're trying to mobilize our knowledge and our approaches and get new ways of thinking when it comes to actually evaluating if services are doing what we want them to do. And that's Habitus in a nutshell. So if there's one thing I'd love you all to take away from today, it's this quote. I love this quote. This is a CEO of a charity in Canada, and this is the quote: "Programmatic interventions help people beat the odds. Systemic interventions can help change their odds." And so the reason I bring up this quote is because I think it's very important within systems change. Is all too often we see in our work that organizations that are terrific at delivering programs can prove evidence and impact from their program delivery, often try and use those tools of impact from programs and to apply it to systems change work. And that is often where the evidence that's produced by those tools and those approaches cannot be as solid, is not always as solid as taking a as taking a systems change approach. And so if there's the one takeaway today, is that we're going to talk about what a systems change approach is, how the tools and the perspectives are different, and how it can result in a lot more knowledge and information for you when you're evaluating or looking to change a system, whether that be in health, children's services, with addiction, with the environment, lots of different places that you can apply it. That's the key takeaway from today.
Thanks, Callum. So, hi everyone, my name's Laura. Um, I'm going to kind of talk to the next couple of slides, and we thought we'd start with kind of how we define systems change, which is often very nebulous and very hard to and difficult to kind of pin down. But the way in which we kind of look at it at Habitus is to consider it as a way of exploring, understanding, and addressing root causes to social issues. So, like Callum said, this can be around kind of poverty reduction measures, mental health, loneliness, and so on. And we draw on the kind of iceberg model as a framework because it allows us to unpick and unpack what's hidden, but also what's visible. And so this is looking at the mental models within kind of systems. So what beliefs surround this, what assumptions are there, what values underpin it ultimately. The structures, that is, who are the key players in the field, what systems and processes are in place, what legislations exist, and is there kind of political will backing kind of systems change ultimately, and as well as the dynamics. And both of these ultimately help us identify the kind of patterns in systems change. So what's happening across the system? Where are there similarities? What differences exist and why? To then be able to kind of identify what's visible and tangible. So the tasks and activities that are kind of being delivered to, say, address loneliness, the loneliness epidemic. And so, yeah, we see kind of systems change as really kind of piecing the puzzle together and looking at where different kinds of elements fit, where they interact, and the role that each of these elements plays in kind of facilitating systems change. And we, from our work, we know that kind of, I guess, defining systems change is really tricky because it can be really messy, and sometimes it's harder to evidence what kind of systems change is happening on the ground.
So this is the tricky parts. And I agree with Laura in some ways, and I don't disagree with you, Laura, at all. We're on the same page. But I wanted to share some of those blind spots, like you said, some of those difficulties in systems change. And the reason I'm a bit hesitant and I want to share in the way that I'm sharing is because so often we are told, oh, the system's too complex, the system's too complex, it's really hard, it's expensive to measure. And that is not what we are finding in our experience. And I think there's been some amazing developments in the world of kind of systems change evaluations and tools and just thinking that don't really make all of those things as true as they once were. Saying that, I wanted to share some blind spots. And if anyone noticed, this slide is like a car mirror. I thought I was being very conceptual and cool, but probably no one's realized that. And there's just a couple of things that I think that we always want to be aware of with systems change, because for sure, it's different to the way that we've thought about some of our delivery of programs and services in any work that we've done. But if we're aware of these blind spots, it can really help us do some really great work when it comes to systems change. We don't want to neglect our context. Every context is different, and we are well aware of that. And in Habitus Collective, the reason that we're really obsessed with thinking about stuff in Canada or North America versus the UK is because lots of us have lived both contexts, and there's subtle differences that are really critically important. You've got to be aware of that context. Often there's this fear that we're overconfident in our small program's ability to change a really big system. And what I would say to that is it's not just your influence. There's influences of lots of different other people pressing and pushing on that system. But if you're aware of that, then again, a systems change approach I think is really strong. That like this very academic term, fallacy of unidirectionality. Holy moly. I think that's just really the idea that you're being changed by the system too. And so when we're evaluators, we look at the organization, not just the system, to see how is that system being changed by everything that's going on. And then that final piece, which I think we're all well aware of now, is we always have to be adapting and capturing kind of what's going the emergence. So everything is always changing. How is our system kind of keeping up to date? How is our thinking, what we're measuring, our impact, adapting to kind of the new world that we're in? Because, you know, in the last few years for all of us, we've had a pandemic that absolutely changed a lot of the systems that we worked in, and the cost of living crisis as well across the Western world is really having an impact and changing priorities for a lot of the systems that we work in. And if we're still using the same frameworks that we were using a while ago, that might not be helpful. So there's just some of the blind spots to be aware of. I always like to put, these are the caveats, but I hate to kill people with caveats because it sometimes has an impact on our confidence of using a systems change approach. And I would say, I know about all the caveats, and still I feel strongly that this is a great way of proving if you're actually having a larger impact.
And brings us nicely to a bit of myth busting around kind of systems change. And this is really taken from us working across different kind of systems change evaluations. And it's something that we've kind of heard from clients, from other evaluators and so on. So we felt that it was quite important to, I guess, look at it from a strengths-based perspective. And it's also to say that how we kind of measure and understand systems changes, that it's never linear, it's very nuanced and is in constant kind of flux, I guess. And so not looking at it as a one-dimensional thing can be really helpful. But some of the things that we've heard is systems change is only about changing big systems, and actually what we think is that understanding where you fit or where your organization fits into the bigger kind of picture is key. And systems change is actually a really helpful way of identifying the role that your organization or you're playing in a kind of bigger kind of role. And is to also acknowledge that small and incremental change is really important to achieving kind of broader, kind of more complex change within the system. The other is that systems change relies on big data. And actually what we found through our evaluation, our work, is that systems change is an opportunity to be more equitable in how we understand impact and the difference that programs and interventions are having. And it allows you to kind of draw on different levels of data and demonstrate impact at different levels. So what we tend to do is look at, when we look at systems changes, actually what differences is having at an individual level, and then an organizational, and then at a kind of a systems level. And we've found that using stories can be a really powerful tool in kind of bringing to life the kind of tangible impact that's being had. And it also helps us address and understand the kind of so what question, because we can have lots and lots of data, but actually what impact is this having on a kind of real lived kind of what impact is this having in the real world ultimately?
You and I are that, like, I can't help but soapbox a little bit on this one, just because what we found with a couple of our clients recently is that, you know, it's the age-old quantitative versus qualitative approaches, and that a lot of our big data approaches are highly quantitative, which is fantastic because it produces data we've never had before. But it is that point of insight. It is not producing, in some ways, those bigger data approaches not producing the depth and the level of insight that a systems change kind of qualitative approach can give as you go deeper into those, really what made the situation change for that person, what factors of change happen. And it allows, you can absolutely zoom in for systems change approaches in a way that not everyone would imagine you could. And I get excited that we can kind of be going back and revaluing a lot of the qualitative approaches that we might not have valued for a little while.
Yeah, and that kind of transitions quite nicely into the kind of third point about systems change not being relevant to small organizations. What we found is that actually small organizations are a really key component in kind of facilitating systems change at a wider level. And so taking that lens and approach can help understand the role that each, I guess, player within the system has in creating change. And it also provides organizations with an opportunity to be really innovative in how they evidence their impact. And that can be kind of through short-term kind of, impact or evaluations to long-term, like longitudinal pieces. We've also heard quite often that system change can be resource heavy and expensive, but actually what we found is that finding ways of kind of gathering, collecting data and insights in a structured and ongoing way can help organizations minimize cost when measuring impact. It's part of good practice, but it also helps kind of inform how a specific activity is contributing to that kind of more the kind of wider systems change. And it also presents an opportunity to kind of consider different ways in which kind of impact can be evidenced. And then lastly is that you need to do a lot to facilitate systems change. Again, because systems change feels like this huge thing that it's really difficult to kind of pin down and make tangible. But actually what we've kind of learned through our work is that in some instances, less is more. What becomes really important is the intentionality behind kind of certain programs and activities and how they, I guess, address the root causes. And so it also offers an opportunity to kind of pause and reflect and, I guess, what is it, get your eggs in a row or ducks in a row, is it? I'm terrible with analogies, but yeah, it could be a real opportunity for kind of pause, reflection and learning to then be able to move forward. So how we approach systems change at in Habitus is through kind of three key elements. The first is understanding and identifying the conditions that facilitate change. So what needs to be in place in order for systems change to happen. So kind of in line with the iceberg model, it's about what practices are in place, what resource flows exist, the power dynamics, mental models, policies, and relationships and connections, which are really key but often overlooked. And so today we're going to hone in on the relationships and connections and the resource flows. And so once you understand and identify these conditions, you can then develop appropriate tools to measure kind of change, which then leads you to then be able to observe patterns and trends around, like, at what level is kind of change happening? Is this kind of incremental, and so on. But it's really helpful framing.
Okay, we've done a lot of talking, so we get to go into the activity. So what this activity is we've done similar things like this with clients that we've worked with in the past. What we are going to zoom in today, like Lyra said, is the relationships and some of the specific resources you might require when you're thinking about creating systems change in your sector. And it's pretty open, this workshop, so it doesn't, we're not necessarily focusing in on how you're supporting youth potentially, how you're supporting a public health campaign. This really can kind of apply to lots of different areas. So we're zooming in on a particular type of resource, which is the human resource. So this comes after we've done quite a few systems-based evaluations now, and these are concepts that we see keep coming up as human resources that are really valuable for when a systems change is desired in a system. So if you've got a couple of these things, it's pretty likely that the conditions are going to be strong for systems change to occur, regardless of what systems change that you want to happen. If you're not watching this webinar or listening live, you can access this worksheet by going on to the Habitus Collective website's resource hub. You'll find the worksheet there alongside the link to this webinar. Laura is going to talk a little bit about a case study. I'm going to put Laura on the hot seat with some questions, but I would love you to as well. Feel free to come off mute if you're okay with that, or pop your questions in the chat as we go along. This is a much more kind of conversational part of our presentation. Take it away, Laura.
Thank you. So as I kind of, hopefully I'll, in the kind of breakout room, I was like, oh, hopefully this case study will explain a lot of it, and I hope it does. But this is a case study based on a complex evaluation that we did kind of last year, and it looks, the program was specifically around safeguarding children, young people, and so you have a kind of an old system which is established, and so it's kind of statutory services like Callum said, health, safeguard, children's social care, and so on. And the program really tried to kind of shift change at an individual level, organizational, and also systems in kind of how professionals were able to kind of better support children and young people, and ultimately kind of safeguard them in a kind of very child-centered, trauma-informed way. And so how we kind of looked at systems change was identifying actually what are the conditions that are being created as part of this program. So that was in part looking at input and resourcing, the different tactics that kind of program staff kind of adopted, and approaches that they took on board, which then led to kind of specific levers, is what we call, but ultimately they're kind of, what are the mechanisms, what are the triggers that cause change? And so that was kind of changes in competencies, again, approaches, skills and knowledge, to then affect kind of systems change from a kind of bottom up approach rather than a top down kind of way of working. And this model, this is a kind of, they call it the two loops model, and it's adapted from the Buchanan Institute. It's really great. Would highly recommend kind of having a read of it. And it's a really nice way of looking at systems change, because it's not linear, it's not kind of one-dimensional, and it takes into consideration the kind of context of the kind of old system and what's needed to create a new system ultimately. And part of that is also recognizing to our activities, like who are those system players? How is the system kind of bound in a way, like who sits where and what do they do in terms of affecting change? I felt that was very too chatty, but anyway, ask me questions, Callum.
Okay, so really specifically then, what were the change that the client was after? What did they actually want to do for children and young people?
So ultimately, the client, their main focus was to equip, not even equip, so change the way in which kind of professionals interacted and engaged with children and young people to then be able to safeguard them better and identify safeguarding concerns. And so they did that through kind of a number of work streams, but ultimately it was about shifting that kind of those values so that they're aligned, finding ways in which, like, the approaches so that they are kind of child-centered, trauma-informed. And so some of the kind of really small but important changes were around how professionals kind of changed their practice by asking young people how they wanted to be identified, taking into consideration kind of stereotypes and tropes around young people. And so, like, really shifting ways in which kind of people, I guess, centre children, young people, and were highly trauma informed, and kind of demonstrated professional curiosity as a kind of, this was an ongoing kind of learning piece rather than a static thing that they did.
So you would say that the systems change approach kind of would you agree with my statement? The systems change approach gave them enough evidence to feel confident that they're making that change. Or they're a part of that change.
Exactly. And it did so at different levels, like, to go back to that. So at a kind of individual level, there was clear evidence that professionals had changed their practice and were continuing to do so. But then the ripple effect of that was that people within organisations were having conversations, were looking to review policies and ways of working that centre children, young people, that were about kind of considering EDI, being trauma informed. It then led to changes in policies and processes internally.
I suppose then, going back to the activity we've just done, I got a great question from someone in my group to say, okay, so when would we do an activity like the one that we've just done? And I suppose that goes to kind of probably the first part of that, creating the conditions of change. So maybe two questions for you, Laura. First one is, like, what was our approach to that? When did we deploy that tool? What did it look like when we did it? And then how did the organization respond? What did they do differently when they had that data? And did they do anything different?
Yeah, absolutely. So we kind of engaged kind of partners and stakeholders quite early on in the process, in terms of kind of understanding actually what is a systems change maker, like what do you need to make a system like work. And so part of that was understanding actually what are the inputs and resources. And what we found was that the program was really intentional in building connection, and was highly relational. But what then emerged was actually there was ongoing kind of resource needs in terms of the amount of time and resourcing that was needed to coach people and to continue to build those relationships outside of their, I guess, their kind of core membership, because it was, again, part of that kind of trickle approach. I don't know if that kind of specifically answers that question, Callum.
So they took more of a coaching approach to the people in their network because they realized actually the outcomes that they wanted required different sorts of skills, qualities, inputs from the people who were doing the systems change work, I suppose. Is that what you're saying?
Yeah, and also part of that was kind of fed into the tactics, right? So they knew that there was a real high kind of appetite for people to be connected, to have those kind of relational kind of discussions and connections, but actually what was missing was the space in which to do that, in which to kind of convene people. And so again, that was an opportunity for the program to say, actually, this is a need, like people want to come together and share their expertise and kind of learnings and kind of strategize, I guess. And so it kind of provided them with an opportunity to be like, right, okay, maybe this is something that we need to hone in and focus in on, because there's a clear appetite for it and we know that it's making a difference.
I suppose I have one last question just around the knowledge thing. And I suppose it's this tension with, I think the easiest thing for a lot of people, in my experience with systems change, is like educate, tell people what to do, share the new knowledge with people in a way. And I suppose it's just asking, I suppose it's my own bias, Laura, but your thoughts on the limit, like how critical is that knowledge sharing piece in the system? Any kind of learnings from that part of like, is it the number one thing? Is it a mix of things, or just your own experience with how do you handle kind of that as always being kind of the primary thing? Is if we just educate young people, we just educate people in the system's going to change. Is that a statement that you would agree with, or not?
I'm not sure it's something that I think obviously kind of having a kind of access to knowledge is always going to be really important, but actually what we tend to do is place perhaps too much emphasis on that rather than how that knowledge is utilized. And so looking at different ways, so like for another program, what systems change program is, we're looking at, which specifically focuses on kind of mental health, what we're looking at is kind of stages of change. So like people might come to an information session, and kind of gain learning, but actually what happens after that, because that's the important piece. And so yes, knowledge plays a really important role, but it's also the kind of follow on from that, like that's where I think the kind of relational approaches become really important, and kind of translating that knowledge into practice is also really key to really affecting change.
Got a couple of questions from the audience. Maybe start with a really simple one. What was the timeline on this project, Laura?
I think it was a year, I would say about a year.
The program itself's been running for a number of years, but the evaluation period was a year. And I suppose that goes back to our myth busting point, is I think there's this belief that even to assess kind of what systems change is happening is that, you have to kind of longitudinal study, we have to be there for years. Data wise, you get really strong, great longitudinal data if you can do that. But there are ways and good tools to be able to do a spotlight, I suppose, snapshot in time of where people are on their change journeys as well. But yeah, particularly this program has been running for we were evaluating year 4 of the program thus far, and it made kind of considerable impacts with the stakeholders that engaged with. The other question we had, and I suppose it kind of goes to kind of one of the comments I was thinking of, is as you said, they take more of a coaching approach. How open to change were said professionals in the way that they approach children and young people? And so I suppose that gets the crux of the matter with any type of change, is kind of what does resistance look like, and how do you include resistance in an evaluation to change? What did that look like in this project?
That's a really good question. And I think that is also something that's really important. I think what we found as part of this evaluation, and again, it goes back to us kind of being able to be quite creative and innovative, was part of our scoping was actually understanding, like, where is the system working really, really well? Like, what are those elements in terms of where is good collaboration working? Like, where are kind of processes and policies helping professionals to kind of better safeguard children. And then what we did was kind of tip it on its head and kind of looked at where is the system kind of breaking down. And this was all collected by kind of speaking to different people within different roles and in kind of the health sector, kind of statutory services like social care and so on. And it gave us a really good picture about kind of what are the kind of common challenges and barriers that professionals are facing. And I think it's also important to say that, like, it goes back to us looking at systems change as a long-term thing. It's not going to be fixed overnight. And actually it's about kind of putting processes in place and kind of embedding systems that over time will kind of shift things at a macro level. But that's not to say that change isn't happening on the ground and individually, which is why it's also really important to acknowledge that, right? Because otherwise, if we're kind of too focused on structural kind of systemic changes, that can take years. But actually what's really exciting is understanding how kind of localized granular activities is kind of building up to that.
Really simple one for you, Laura. In a nutshell, the differences between conditions to create change and levers of change.
So the conditions goes back to, I might go back to that little diagram, this one. So these are the conditions. And so it's almost like elements of systems change. So you can say in the kind of mental health field, you can have kind of different practices, different policies that support kind of new models or ways of working. There's also the mental models, again, that kind of values-based system, relationships and connections, power dynamics. Whereas, what is it, the levers of change, I like to think of them as kind of, what are the triggers that kind of affect change? So like if we're looking at competencies, going back to the exercise that we did, like what are the competencies that individuals need to then be kind of change makers? What approaches need to be in place? Like what we've discovered actually is relational approaches are often really overlooked, but can be incredibly important in kind of in affecting the systems change across different levels. So I hope that answers the question.
I always like to actually think about levers as in like, I don't know,
Oh,
like
as a
this big
lever.
machine that you're like pressing buttons and because it's really, lever actually does something. We actually do a lot of stuff sometimes in our work, and the lever, you know, it's like that light switch that doesn't actually turn the light on or off. And that's the fun thing about looking at different levers is some levers don't actually do anything, and that's what we do through our testing, through evaluation. We're probably not going to be able to get to all the questions within the hour. Laura and I are going to be available for about 15 minutes after the session to connect with any of your particular questions, but I'm going to choose one more. And I think it's a really great question about, I love it. Apologies for using the F word, but it's the charity F word, which is hilarious. Thanks, Will, for that one. You're absolutely right. Like, where does the funding come into in this model? It's not obviously the whole story. But it's part of the story, 100%. And what I would say is just in the world that we're working in, both, like I said, Habitus is in North America and Canada. We work in across the UK and a few bits of Europe, in Ireland especially. And I think that there is a trajectory that lots of different types of organizations are starting to move towards systems change thinking. And I would agree that's a great move, and I think we have to be aware in the world of service delivery, social change people, that's kind of some of the trajectory, and we need those skills. Because my worry is if it's in vogue, but we're not able to use the modern tools to actually prove that systems change is a great theory, and there's ways of proving the evidence, we might fall back into the way that we were working before. And one of the issues may be that we can shift the systems change model, but if there, like you said, if there's not a lot of funding kind of made available or enough funding made available for the proof parts, that's going to be an issue. I'm going to kind of just share one of my tricks and tips with you, Will, and I think we chatted about it in our breakout group, is that I really have found that the key learning we've had is to try and not think about it as a traditional evaluation. We often like to think of ourselves as a learning partner. I don't know, sometimes people say that's just the language of terms that is updating. But if people in the system can think about this as reflective practice, as professional development, if the evaluation tools that we are using people can see in real time how they're learning rather than kind of the pre and post survey, which we're probably much more used to in a programmatic way of working. It's easier to find chunks of funding because often there's a professional development budget, often there's time kind of set aside for things like that, which traditionally there isn't always in kind of evaluative approaches. And so I would, I suppose it's my creative advice on when we're kind of taking this approach is to think a bit wider and be comfortable with renaming some of the things that we do in evaluation to call it learning. I don't know if you got any other different insights, Laura, on the F word.
I guess it's also about kind of like, to me, kind of systems change can be really equitable because you're acknowledging kind of what those structural barriers are. And I think that kind of anything that kind of tries to move and yeah, I think that there's also kind of that innovative approach. And it speaks to what you said, Callum, about how you kind of evidence change, right? And kind of, yeah, I think it can be done in a really equitable lens as well.
Then if you can come to our last slide, Laura. So we kind of call this the virtual foyer discussion. So Laura's email's down there, my email's down there. Please email us. We're collaborative for a reason, like I said right at the top of the session. We're a little bit obsessed and passionate about this topic, and we're trying to kind of get more people on board and to collaborate a bit and to kind of share our learnings and our insight, because that's what our organization's all about.
So thank you so much for joining us today. We hope you found the session insightful, useful, interesting, at the very least. If you have any questions, as we've said, please feel free to contact us, either via email or on social media.
Yeah, thank you as well for coming along. Can't wait to work with a few of you in the future. And the bigger the community we build for systems change, the more people are going to adopt it and have higher quality evidence as a part of their approaches to evaluation.